Some people has some questions about the difference between functional medicine and the traditional medical treatment. In reality, the huge majority of people with chronic diseases have enough experience in the traditional medical management. Functional medicine is a personalized medicine that tends to prevent and identify diseases and medical conditions in the person through questionnaires and accurate evaluation, both physical and laboratorial, in the patient. In other words, the medicine is individualized and does not follow protocols because every human being is different. So the idea of the functional medicine is to identify and then to explore the possibilities to correct the abnormalities in the function of the symptoms of the systems or in any part of the body. The persons that have been experiencing treatment in the conventional medicine will see that it is followed by some protocols that are pretty similar from patient to patient. But if we think that everybody is different, then you cannot use one medication or one system to treat everybody. For persons, for instance, with rheumatoid arthritis or any autoimmune diseases, you will see that the doctors and specialists will use the same sequence of events with not many variations from person to person. In our case, functional doctors try to determine the root of the disease, from what part is coming the disease, which is the physiopathology of the condition, and how to fight that condition. And of course, functional medicine, it is safe for everybody because actually it's becoming the medicine of the 21st century. Many patients are very frustrated going from doctor to doctor without many changes in your general condition and just a change in one medication for another. So functional medicine, again, is personalized and is individualized to the patient's need.